Hi everyone, thank you for taking the time out to join us on the Flow Initiative Zimbabwe. My name is Dr Fungisai Hove. I'm an obstetrician and gynecologist in Harare, Zimbabwe. Today we'd like to take the time out to talk to you about your menstrual cycle. We get lots of questions on this page asking us about whether this is normal or this is abnormal. Basic questions about the menstrual cycle. So we decided to talk about it as this is what our initiative is all about, talking about menstrual health and empowering women to know more about their menstrual cycle. What is your menstrual cycle? Most people think their menstrual cycle is just the days that they bleed, the periods that they have. But your menstrual cycle is not only limited to the days that you bleed. Even when you're not bleeding, your body is undergoing changes in its female reproductive system that enable it to be able to get pregnant. That is what a menstrual cycle is about, the ability to get pregnant every month. It is a complex interplay of hormones. Hormones are chemical messengers made one part of the body that go and act in the other part of the body. And we have a complex interplay between hormones from the brain, the ovary, and they also then go and affect the uterus. So all of this culminates in either a pregnancy or your periods that we then see as bleeding. It's a very complex cycle, but I will try and break it down to basic terms that we can all understand. Even I have a difficult time understanding it sometimes, and I went to school for it. We'll divide it into what's happening in the ovaries, and what's happening in the uterus. The ovaries are where our eggs are produced that we release every month. These eggs can be fertilized to either produce a baby or not fertilized. So what happens in the ovaries is we have follicles. These follicles are what develop into the egg that's released monthly. The follicles start developing in your ovaries, and as they develop, there is a dominant follicle that then becomes most prominent. As this dominant follicle is developing, it's producing hormones, mostly our hormone estrogen. This hormone estrogen is our sex hormone, and it communicates with the uterus, affects the uterus to cause the lining of the uterus to thicken and to grow. As the dominant follicle keeps on developing, the estrogen levels increase, and then these estrogen levels communicate with the pituitary gland, which is found in our brain. And this pituitary gland releases another hormone known as luteinizing hormone. This luteinizing hormone then communicates back again with the ovary that it's now time to ovulate. Ovulation is the process of where the egg is released by the ovary, and then it's taken up into our fallopian tubes. Our fertilization occurs in our fallopian tubes. When the egg is released, the part of the dominant follicle that is left behind forms what is known as the corpus luteum. The corpus luteum releases another sex hormone known as progesterone. This progesterone communicates with the uterus that it's time to develop and prepare for implantation, is that the egg is released and fertilization can occur anytime. So the uterus is now preparing, is becoming nutrient dense, it's increasing in blood vessels as it prepares for possible fertilization and implantation. When the fertilization doesn't occur, the levels of progesterone and estrogen then decrease. The decrease in the levels of estrogen and progesterone then communicate to the uterus that no, fertilization didn't occur, so it's time to shed the lining because there's no baby coming. And that's when we see our periods. And our periods occur monthly, and we can bleed for 2 to 7 days, or the average day being 5 days. So our menstrual cycle can be affected by many things. This includes anxiety or stress. It includes our weight, either being underweight or being overweight. It includes the food that we eat. It includes the drugs that we take, including hormonal drugs. And it includes diseases, if we are sick or not sick. These can all affect our menstrual cycle. And how we see whether our menstrual cycle has been affected, it is shown by a change in our periods. Our periods start at around the age of 12. That's the average age of when periods start. But they can start earlier, as early as the age of 9, and can delay as late as the age of 15. If you see your period starting before the age of 9, it can be normal, especially if there's a family history of this, but you should also just visit your gynecologist to exclude other conditions such as precocious puberty. If you see you're getting to the age of 16 and you haven't started on your periods, you should also go and see your gynecologist to find out why there is a delay in starting your periods. Your periods should usually start 2 to 3 years after your breast buds appear. And if this hasn't happened, I encourage you that you visit your gynecologist or inform your mom, who will then come with you to visit your gynecologist and find out why your periods haven't started. As I said before, the average period length is 5 days, but the normal days is a range of 2 days to 7 days of bleeding. We usually bleed about 10 to 80 mils of blood, but that's obviously something that we cannot measure. We rely on you to tell us whether or not you feel like these periods are heavy. What can happen to your periods? Your periods can either be absent, or they can be irregular, or you can bleed too few times, or you can have heavy menstrual bleeding, or you can have irregular bleeding. So when they're absent, you can have what we call primary or secondary amenorrhea. Amenorrhea means you are not going on your periods. Primary amenorrhea is people who have never gone on their periods. Like I said, get to the age of 16. If you haven't gone on your periods, visit your doctor. Secondary amenorrhea is those people who have been going on their periods, but then their periods stop. The most common cause of this is pregnancy, but some people don't want to admit to it. But if you see that you haven't had your periods in 6 months, even when they used to be regular, visit your gynecologist. Or you can have what we call heavy menstrual bleeding. Heavy menstrual bleeding scientifically means more than 80 mils of blood every month. But like I said, we can't measure that. We rely on you telling us that you feel like, one, the number of days that you have been bleeding has increased. You feel like the flow is heavier than before. And you feel like the days in between your cycles have changed. They are less. You used to have a 28-day cycle. Now your cycle is 21 days or 19 days, and it's getting shorter and shorter and shorter. When you feel like you have heavy menstrual bleeding, visit your gynecologist. There are a number of things that can cause heavy menstrual bleeding, the most common being fibroids. So do visit your gynecologist to find out why you have heavy menstrual bleeding. So you can also have irregular bleeding, where you are not having a regular cycle, where you can bleed sometimes and then skip 2-3 months and then bleed again, or where you can skip 6 months and you bleed again. When that is happening, visit your gynecologist. This irregular bleeding can be a sign of hormonal imbalance. Hormonal imbalance is when there is a discrepancy between your sex hormones that control your menstrual cycle, and that can lead to an irregular cycle. I suggest that you visit your gynecologist when you're having such irregular cycles. We are mostly guided by your pattern of the cycle. I recommend that you keep a diary of when you get your periods, so that you know how long your cycle is, how many days you bleed. Your cycle doesn't necessarily have to be exactly 28 days. It ranges from 21 days to 35 days. And you don't have to bleed on the same day every month. It can change plus or minus 2 days or plus or minus 4 days. That is all normal. But it would help when you keep a diary, so when you think something is wrong, you bring your diary to your doctor and they're able to follow the pattern and note, yes, that there is something wrong. So I encourage everyone, young or old, if you're going on your periods, just keep a diary so you can note that something is wrong or not wrong. So we obviously don't bleed for the rest of our lives. We reach a state that is called menopause, where we no longer bleed. And the average age of menopause is 50 years of age. But menopause can start as early as the age of 45 and it can extend to the age of 55. You can have early menopause where it happens before the age of 45. However, if before the age of 40 you notice that your periods, you are no longer going on your periods, I suggest you visit your gynecologist, because this is known as primary ovarian insufficiency, and there'll be something wrong that's causing you to not bleed. If you see yourself bleeding beyond the age of 55, and it may appear regular and you think you're going on your periods, I highly suggest that you visit your gynecologist, because you're supposed to have attained menopause by the age of 55, and we need to examine and evaluate and rule out that there is nothing sinister that is causing you to keep on bleeding, such as endometrial cancer, beyond the age of 55. The menstrual cycle is something that happens to all of us women. It is a beautiful thing, the ability to be able to get pregnant, because that is what it is. Just the ability to be able to get pregnant. Obviously, we cannot get pregnant every month in our life. We spend most of it shedding or going on our periods. And like I said, sometimes things can go wrong, like not going on your periods at all, irregular cycles, heavy menstrual bleeding. So what you can do at home is keep that diary. And when you see that something is happening that is not correct, visit your gynecologist. We thank you for taking the time out to watch this video. Follow us on Facebook on the Flow Initiative, on Instagram, the Flow Initiative. I know that I had a lot of questions as I was growing up concerning this topic, because we don't talk about it much in our society. If you have any questions, please ask in the comment section below. If you want to give any comments or suggestions, go ahead, please do. We appreciate your participation and look forward to engaging with you further. Till we meet again, my name is Dr. Fungisai Hove.